It's Real Talk with Jimmy Moore and Dr. Will Cole. Join us as we go deep into real life, talking about what really matters in your health, relationships, and every aspect of your life. There's no fakery here, you guys. Just real talk from two guys who are really real. Now here's Jimmy Moore and Dr. Will Cole. Hey guys, we're back here on Real Talk with Jimmy Moore and Dr. Will Cole. And go to llvlc.com. You can see all of the episodes that we do there with all the family of podcasts under the LLVLC umbrella. But Will, what's up, man?
What is up, Jimmy? I'm so excited for today's guest today. I think it's really important information for people to educate themselves about, and something that they're not going to be hearing, very often. I think that it's really going to be novel information for people right now.
Well, and we've been talking about a lot of real stuff lately. Like we rebranded this show from Keto Talk to Real Talk recently, and it don't get no realer than the coronavirus COVID-19 stuff right now. And I know you're trying to put out positive vibes all over your social media, as am I. But I got this interesting Instagram DM the other day from a longtime friend of mine. His name, Dr. Keith Berkowitz, and he used to work for Dr. Atkins in his complementary medicine clinic in New York City. And he's like, dude, there is this remedy out there, this protocol that's being used by various doctors around the country treating patients on the front lines of this COVID-19. And where a lot of them are on the respirator for 2 to 6 weeks, he's getting them off the respirator within 48 hours. I'm like, okay, you got me intrigued. Let's talk. So Keith, welcome to the show. And yeah, man, you intrigued me with this. And then we talked for 20 minutes on Sunday morning. And I'm just like, why is this not getting out there more? So what's up, buddy?
Good. Thanks for having me. It's nice, interesting when we go from talking about reactive hypoglycemia to COVID-19.
Yeah, that's way back in the day. He was the first one, Will, that put reactive hypoglycemia on a low-carb diet on my radar screen. So, all over the board. But you've always been very eclectic in your knowledge, Keith, so that's why we got you here today. But why don't you tell us kind of generally the story in short form of how you came across this protocol?
Okay, so what's interesting is, I've always been looking at integrative medicine as kind of my, guide to treatment. And what we're seeing now is this overwhelming virus, right? We all read about COVID-19. You turn on the TV, turn on the radio, turn on your computer, you're inundated with COVID-19, the forecasts of it growing dramatically, people dying, and myself practicing in kind of the epicenter right now, which is New York City. I felt like I needed to do something more about it. So I woke up Friday morning at 5 o'clock and started doing research. And what I looked at is I wanted to see if there were other methods for treating. And one of the things we always kind of get confused in medicine, we sometimes kind of treat down from the top down. And I wanted to see, maybe it's not the virus that's all the problem. Maybe it's something the virus does that is leading to all this, mortality and sickness and, people really having a hard time recover. And we always talk about disease here. For example, for ventilators, when we've gone through the influenza epidemic, people who end up with influenza are probably on the ventilator for 2 to 4 days. With COVID-19, you're looking at 10 to 21 minimum. I mean, it's scary.
Yeah.
So I always think, let's look at the root cause. And Will knows a lot about this, from his nutritional chiropractor.
Will wrote a whole book about it. So.
And my colleague, who we're both friends with, Nigma, who's a naturopathic doctor, said, whatever I think as a conventional doctor, I need to take a step back and think of the root cause. So what I looked at what was causing the death. And in this case, what we think about is septic shock. So septic shock is really what happens when the body kind of fails. People end up becoming on a ventilator. They end up needing blood pressure support. And when that's not treated effectively, the organs fail. And that's what, at the end of the day, leads for them to expire or die. So I wanted to see, is there any research out there looking at septic shock? So I found this study by this Dr. Paul Merrick, who's out of East Virginia Medical School, that was published in Chest in 2017. And if Chest is really the kind of the premier journal for pulmonary physicians around the country. And this gentleman, Dr. Paul Merrick, is head of pulmonary medicine and critical care medicine and runs the intensive care unit at East Virginia Medical Center.
Mm-hmm.
And he looked at hypothesis using, I always laugh when I say this, vitamin C, if you can believe, combined with thiamine and in some cases steroids as really a treatment option for severe sepsis or septic shock. And I'm reading this article. I'm like, oh my God, this is something I already use in my practice every day that works.
Yeah.
And what he found out is when they gave it intravenously, and the key in this case, within the first 6 hours of them entering the emergency room, mortality dropped. And hear this, from 40% to 8.5%.
Wow.
And the problem, it's right, dramatic.
Amazing.
And what the interesting part about it is, and what the difficulty in medicine today is, when we think of septic shock, nothing's ever worked.
Right.
I mean, and that's where I think a lot of health professionals are having a lot of trouble today in this crisis. You know, typically when we think of inflammation, right? I mean, and I'm sure Will and Jimmy talks about this all the time. Any disease process, one of the things that always comes about is inflammation, from diabetes, insulin resistance.
Will wrote a book called Inflammation Spectrum, and so I know he's chomping at the bit to ask you some questions.
Yeah.
Okay, I'll be quick. I promise.
Yeah, no, this is great.
So again, the question becomes, and again, we've all focused on the virus, but really at the end of the day, the virus doesn't kill many people. It's the inflammation that kills people.
Right.
And I think the problem is we're running to this country is that we're really basing our treatment based on influenza. Mm-hmm. Because we think about what's the virus we deal with every year that is the leading cause of death in the United States is the flu. The problem is this coronavirus is different. It's really creates this inflammatory process that gets out of control. Mm-hmm. And that process is what leads to people dying. And again, sadly enough, in Queens yesterday alone, Queens, New York, 200 people died from coronavirus.
Yeah.
5 minutes ago, my nurse just told me her cousin in Germany just passed away, 43-year-old woman.
Wow. Horrible. So for people that don't know, Keith, can you tell everybody your background before all of this? And we jumped right into Corona, but what's your background from a clinical health standpoint?
Oh, great question. So my background actually is, I'll go back in time. So I actually trained at actually North Shore and Sloan Kettering. So I did my residency, actually worked as a hospitalist for 5 years. And those are really the people today that are on the front lines with
right.
care now in the hospital. And then I had the great pleasure of actually working with Dr. Robert Atkins. So,
awesome.
Yeah. Actually, can I tell a quick story about me going to work with him?
Sure. Yeah, go.
It can't be as funny as Jackie Eberstein's story, but go ahead.
Oh, yeah. Yeah. Well, Jackie, I mean, she beats me by like 30 years.
She's the queen, yes.
No, my story is pretty funny. So I'm at the hospital resigning. You know, I go meet with my chairman of medicine. I'm like, I'm going to go work for Dr. Atkins. And people don't remember in the early 2000s, late 1990s, Dr. Atkins wasn't kind of highly thought of in the regular medical community.
He still isn't.
And so I go to my chairman. I'm like, you know, by the way, I got a job with Dr. Atkins. What do you think? Should I go? And he goes to me, he goes, oh, yeah, you should go. You'll learn a lot. I think you've done as much in the hospital as you can accomplish. You know, good luck. And I'm like, I don't think you heard me correctly. I go, I thought it was. I go, I don't think you heard me correctly. I'm going to go work for Dr. Robert Atkins. You know, the Atkins diet. He's like, no, yeah, I think you should go. I'm like, wait a second. I don't think you're really understanding me. And he was starting to get irritated. I go, I'm going to go work for Dr. Atkins, you know, that diet doctor that's dismissed by everyone else. He's like, Keith, I actually really mean you should go work for him. So awesome. he was actually, and he told me later that he felt that for me to progress in my career, I needed a new experience and to really work with, you know, I would call probably one of the giants in the field. And again, you know, I know Jimmy and Will know all about this because you guys talk about Keto Talk all the time and low carb. And really, he's one of the big pioneers in this. What people don't really remember about him from an integrative medicine standpoint, he's probably the grandfather of integrative medicine and allows all of us to practice the way we do today, both Will and I.
Yeah, for sure. So if I could dive into real fast, the vitamin C, is this something that you are doing currently with your patients now after uncovering the research that you found? How is it being implemented right now on the front lines, specifically in New York City at this point, the epicenter of COVID in the United States?
So what's interesting so I'll take it a little bit back a little bit. So there's really 4 hospital centers that are looking at it and using it. So really what they saw, and even a step back further from that, it was really widely used in Shanghai. One study from Shanghai 10th Hospital showed that they actually treated 50 people, all got high dose vitamin C. And actually for them, it was actually anyone who got tested positive for COVID-19 was treated. And in that first 50 people, the mortality rate was 0.
Wow. It's amazing. So what at this point it's being, you said out of Shanghai, and now there are certain institutes in New York that are doing this as well.
So fast forward, if you don't mind, I'll say around the country. So the next step was East Virginia Medical School, which Dr. Paul Marek, he started it, and he actually adapted the protocol to add things like hydroxychloroquine, add things such as Zithromax. He added zinc. He added melatonin, interesting enough. And he adapted it, and he's actually treated 8 patients so far. And one of the sickest ones is my favorite case. He had an 86-year-old man come in 100% oxygen who within 3 days was fine.
Wow.
Extubated, fine, talking on the medical floor. So then the doctor in Houston adopted it. It's actually now on protocol for University of Wisconsin for Madison. And they've even taken it further. And the doctor, his name is Pierre Corey, texted me this morning saying not only are they using the ICU, they're using it on the regular medical floor. So it's really become standard of care for many of the patients that come through who are COVID-19 positive. In New York, where they're using it is at Northwell Health System, which is based out of Manhasset, Long Island, and has centers around the city. It's actually the largest health network in New York State. And they've had over 90 patients treated with very low mortality rates.
It's great. So it's promising. What do you think as far as, is there any pushback in the conventional setting, seeing these doctors treat these patients with vitamin C, or is it something that's well adopted and accepted because it's an emergency situation and they're open to new ideas?
That's a softball question for you, Keith.
You know, it's so funny, Jimmy. I'm used to the other ones. Hardball.
Yes, I know. That's why I thought it was funny.
Yeah, so it's clearly not widely adapted. And that's been one of my missions. And I've really been working hard since Friday afternoon. And I actually spoke to every doctor around the country that's using it. We're really making it difficult. The problem is, what's really interesting about this is we're all trained in a hospital-based model. This is really field medicine for the first time. In a sense, it's almost like you're on a battlefield. And I think we're used to looking at things like double-blind studies and, really tight research. The problem is, by the time that comes out, that's going to be 6 to 8 months down the road.
Yeah, it's too late, right? Yeah.
Exactly. And what's interesting, the reason why it's easy for me, the last part of my training was I actually trained in the mid-90s at St. Vincent's in the middle of the HIV epidemic. So I learned that was field medicine. We didn't know what worked.
Right.
And I think going to your point, Will, we're at a point where people are dying very quickly. And I think Dr. Fucci talked about up to 200,000 people may die.
What's up, guys? It's Will. As you probably know, my day job is consulting people around the world via webcam at my functional medicine health center. Normally, I'm consulting one-on-one, but I'm really excited to announce the launch of my brand new functional medicine online group class. This virtual group class is my solution to continue making functional medicine more accessible and more affordable for people around the world. Designed as a starting point for those who are new to functional medicine, this online group class allows you to learn more about your health from a functional medicine perspective, equipping you with the knowledge and tools to improve your health. During the class, I will review the comprehensive blood labs that you've completed before the class and give an explanation of the optimal ranges for each and every marker and what it means for your health. You will also have a chance to privately ask me and my team questions and have them answered in real time. You will also receive your own takeaway list from your labs so you can refer to it at any time after the class. In addition, everyone in the class will receive customized action plans based on their lab results, personalized lifestyle recommendations, and a list of foods and supplements to focus on and foods to avoid, all based on your lab results. You will leave the class feeling empowered and educated about your wellness. Learn more at drwillcole.com. That's drwillcole.com.
Can we talk about why vitamin C is so kind of vilified by the mainstream medical community? Your colleagues there, I know you practice integrative medicine and Will does functional medicine, but it seems to me there's no harm in giving this high dose vitamin C. What are they worried about?
So let me back up that no harm. So that trial in China, no side effects. So no problems with vitamin C. I think what it is I think it's not the way we're taught. I mean, Will can tell you this as well. He knows as well as I do. And sometimes what happens in medicine, we sometimes miss the most simplest of treatments. And it goes really to, what are you treating? Are you treating the virus, or are you treating what's underneath the root cause, what's causing the problem? And I think often we treat, again, I was saying earlier, top down, we treat the symptoms, but we don't look to what's happening. And vitamin C was, talked about from Linus Pauling. The guy actually had 2 Nobel Prizes. I mean, I think to me that's pretty impressive. I think he's the only one in history that has that. And the point is that it's a simple, easy treatment. And in medicine, we often overlook that. We look for the complex. If I can go for a tangent for a second, I'll give you an example. I texted a pretty prominent doctor, and I was telling him about the treatment. And his response to me was, oh, yeah, there's a drug in phase 1. It looks promising. I'm like, okay, what about the vitamin C? He's like, well, I didn't see any studies to prove it. I'm like, if something has no downside, why not try it?
Mm-hmm.
Are there any known downsides, Will, to taking a high dose of vitamin C? Don't you just excrete any excess that your body wouldn't use?
Yeah, exactly. It's a water-soluble vitamin. The most common symptom is just GI upset if you're taking it orally. But for Keith, are you seeing any downsides to this? I mean, using higher doses of it, and then specifically, what are the doses in the trials that are being used?
So if you look at again, in my personal experience in practice, we've used pretty safely 20 to 25 grams of intravenous vitamin C at a time.
And what's the RDA?
RDA, oh my God, it's
minimal. It's like like a half of a gram, I think.
Yeah. So the real fear, and the reason why there's a lot of confusion, it's really the renal aspect. People thought that it would more likely form kidney stones.
Yeah.
But again, that's not really been shown at the dose of 6 grams. So what the trial is using is really 1.5 grams every 6 hours. And so again, that's 6 grams a day. There really hasn't been shown to be any side effects. What I see in practice, the only complication I really ever see is it can worsen blood sugar. So you need to actually eat when you take in intravenous vitamin C. It can cause your glucose to drop. So Jimmy knows I love the term reactive hypoglycemia. It does can trigger that low blood sugar response. That to me, I've seen as the major side effect, actually.
Got it. So the trials that are the way that this is being implemented right now, you mentioned field medicine. What's the typical procedure look like for people that are listening right now? Okay, if somebody does have COVID, if they're going to one of these hospitals in New York that are doing this, or anywhere else in the world that are doing it, what does the patient go through to get this vitamin C treatment?
I think the difficulty is it's got to be on formulary there, and it's got to be used. So again, that's still limited. I mean, one of the things I've been working hard today is through the mayor's office of New York City. They're looking at the data right now, actually. So hopefully they'll say yes, and then it'll be more widely used. I think if New York City adopts it as a whole, you'll see the whole country adopt it.
Yeah.
That's the beauty of it. Mm-hmm. So would you like to know how it's done and how?
Yeah.
Okay. So basically what the theory is, again, let's talk about the sickest patients first. There's really a time essence. Time is really a big deal. So when people have septic shock, and again, septic shock are your sickest patients that are at risk of what we call organ failure and ventilation as well, requiring a mechanical ventilator. So those are the ones that really have to be treated within 12 hours and actually have the best outcomes when it's under 6 hours. So time really makes a big difference, because once this, process of organ failure starting, it's very often difficult to reverse. So if you miss that period, that's where the most difficult. Dr. Marek out of East Virginia thinks with the COVID-19, it's day 6 to 8 that people are seeing that it's after the first 6 days to the 8th day, that's when they tend to really deteriorate the quickest, where their oxygenation starts falling, they're short of breath, their fever is high. In fact, I've been managing a patient at home. She had 103 fever for 7 days.
Wow.
It's crazy.
And now with day 12, it's a first day being afebrile. Mm-hmm. And again, as an individual, that's panicking, right? Mm-hmm. I mean, you're sitting with a fever forget that as an individual, as a doctor, it's panicking. Mm-hmm. I was panicked. But again, as long as, they're maintaining their oxygen level, people can maintain that. So it's a really different than we've ever been used to before. So getting back to the protocol. So the vitamin C is given every 6 hours there, and it's actually given with thiamine. Thiamine is also known as B1. And the reason thiamine is used in this purpose is thiamine actually helps the body clear something called lactic acid. Lactic acid. And Jimmy, have you done talks on insulin resistance, right? And Krebs cycle?
Yeah.
So lactic acid occurs when the Krebs cycle is not working properly, where the body no longer uses what we call aerobic or oxygen as its method of getting the body to work. And that's a very toxic element to the body and actually leads to organ failure. Thiamine, interesting enough, B1, actually helps clear the body of that. The next part of that is, and this is really only done in the sickest of patients, is IV steroids. IV steroids is actually the most controversial part of this because typically we think of steroids worsening an infection. But interesting enough, when people get into lung failure, it's called ARDS, which is when the lungs stop working and they need a mechanical ventilation, then the steroids helps. What's interesting about the steroids, and the last point, is that the steroids actually help vitamin C work better. And vitamin C helps the steroids work better. So they both work together synergistically.
You would think they would have made a medication that would combine those two, kind of like what they do with statin drugs, throwing the CoQ10 in there. Do they have a combined medication that you know of?
The problem with that, Jimmy, is that for the regular patient, you don't want to give them steroids because the steroids definitely can make the virus increase and replicate more.
I got you.
That's the danger. So what it is, it's almost like a catch-22. We've always been taught in the influenza group that steroids is really detrimental. So again, COVID-19 is different, and we have to treat it differently.
Got it. So is this treatment, you mentioned every 6 hours or so they're getting this dose. Is that how many days are they going for? Is it until symptoms resolve or what are you seeing there?
That's what's not clear yet. So again, there are a couple people using it as long as they're in intensive care unit. But it seems that actually continuing it through their hospitalization tends to be more effective in their recovery. Again, because what it is, it seems that the vitamin C levels really drop rapidly. So getting back to that point, and I should have said this before, people that are actually seriously ill, 88% of them have low vitamin C levels. So the problem with vitamin C, it's cleared so quickly, that creates an issue.
Mm-hmm. They're calling him now.
You're in high demand, Keith.
High demand.
Sorry about that.
It's Governor Cuomo. You should take his call. So
I don't think it's him because I think he's on TV right now.
Yes.
So what happens is vitamin C doesn't last long. And that's one of the issues. So originally they only did it in the intensive care unit. We think that it has to be continued throughout the hospital stay. It's really not clear completely what the optimal. Some people say 4 to 7 days.
So, Keith, the vitamin C is kind of the key point of what you've been talking about here today, but we know, at least from some of the things that I've read, vitamin D is also playing a role in kind of the healing process of this, as is cholesterol in the blood. And we see a precipitous drop, at least some of the information that I've been looking at, precipitous drop in their total cholesterol levels over the first, few days of this COVID-19. And then as they heal, it comes back up again. Do you know any of the mechanisms going on there and what role cholesterol and vitamin D play?
Sure. I'll start with vitamin D first. Vitamin D is probably the earliest contributor from a positive standpoint. A lot of studies now show that the way the COVID virus actually gets into the cell, I should say COVID-19 virus, is through what we call an ACE2 channel. And what's interesting about that, it seems that vitamin D does protect people from actually getting as much of the virus into the body.
As a preventative.
And what's interesting, right? What's interesting about men and women, it seems that women actually are not as susceptible as men to this virus because they have naturally higher ACE2 levels. But what's also interesting about the vitamin D, and this is something I learned that didn't know before, vitamin D is dependent on vitamin C. Mm-hmm. So it all is together. But actually, the protocol that they use in East Virginia does include vitamin D. And actually, that's the newest addition they just added this week.
What dosage?
They're using, I would say, probably 1,000 to 2,000 IUs, not that high of a dose.
Oh, so a minimal IU.
Yeah.
Okay.
And probably the reason for that is that a lot of the studies, when they try to give vitamin D back to make a difference, it didn't work effectively. Mm-hmm. And that may have been, again, with the sickest people having a depleted vitamin C level.
Of course, we're also habitually, as a society, low in both C and D.
Right. Absolutely. I mean, again, that's so interesting. We never really think about measuring vitamin C levels, right? I've never been trained to do that. Mm-hmm. Will, do you measure in your practice?
No, we don't. Yeah. I don't even know if there's it's not a standard test, even in functional medicine. It's not looked at.
I mean, there is a serum level you can draw. You can draw a serum level for vitamin C, but it's not, I've never myself been trained to kind of look at that from that aspect.
Well, maybe after this, what we're learning so much about how this virus is working, it probably will be a part of more people's standard tests. The more the data comes out as this being beneficial.
Are you looking for whole food supplements for your ketogenic lifestyle? Then let me introduce you to Further Food. Go to furtherfood.com and you'll see that they source the highest quality ingredients on the planet. They have collagen peptides and my favorite, the gelatin powder to make those yummy gummies. And all of it is sourced from grass-fed, pasture-raised bovine collagen from Argentina, Paraguay, and Uruguay. Guys, this is really high-quality collagen and gelatin. There's no hormones or antibiotics. It's non-GMO, and it's the most tasteless and easiest to use on the market. And if you're not using collagen and gelatin, you need to be adding this to your ketogenic lifestyle. It helps reduce wrinkles, increase skin elasticity, making your skin firmer and softer. Collagen helps nails and hair grow longer and stronger while helping to rebuild your bones and strengthen your joints and ligaments. Collagen also helps with digestion and will help you curb your carb cravings. Again, head on over to furtherfood.com, enter the coupon code Jimmy at checkout, and you'll get 20% off your order. Elevate your wellness. Further Food.
We didn't talk about specifically the mechanism of the vitamin C. Obviously, we know it as this regulator of the immune system. Can you kind of go through for us the proposed mechanism of maybe even just how you feel vitamin C is being beneficial for these people during the treatment?
Okay. So I wanted to ask, before I get to that, can I answer his other question?
Sure. Yeah.
Oh, yeah. Cholesterol. Yeah.
I was going to go back around. I've done this a while, Keith. So.
But I don't want to forget you.
No, you're good. Thank you.
So the cholesterol is interesting. So when you look at cholesterol really comes about with two mechanisms. 30% of the cholesterol comes from an absorption. So actually from absorption through the gastrointestinal tract. 70% comes from liver production.
Endogenously.
The problem in any serious disease, one of the problems happens is actually liver production gets affected. So the liver in very sick people is one of the first organs that are really massively affected. And so when liver dysfunction happens, what you're going to see from that, you're going to see much more likely very low levels of cholesterol. What's interesting, can I give another point about cholesterol for a second?
Yeah, please.
So when I did my training in Sloan Kettering, you know what the number one marker for death from cancer was?
What was it?
Low cholesterol. So we found that people with a total cholesterol below 100, their survival from cancer was almost zero. Mm. It was the most accurate marker for survival in disease.
I'm shuddering thinking about a total cholesterol under 100. The mental health effects of that alone just drive me crazy.
Yeah, that's a side effect. But so it's interesting. So cholesterol is really a reactive product to liver dysfunction, I think, in this case.
So vitamin C, how is that? How do you feel like that's working in the body for these people? Okay,
so vitamins, you know how they talk about vitamin D being like the super vitamin? I think maybe C is going to be the new super vitamin. Mm-hmm. So it's going to replace that in a lot of ways. So again, our immune system is really dependent on vitamin C. I read one study where they talked about white blood cells, for example, their ability to fight off infection when vitamin C is depleted in animal studies, that ability drops from 100% to 12%. So you actually, if you lose your ability to make vitamin C, you can have an 88% think about 80+% decrease in the ability for your immune system to work.
Mm-hmm.
That's devastating. So the way it works, vitamin C actually goes through this thing called a sodium vitamin C transporter. And that's the channel. So if that channel doesn't work properly, and what it turns out when the body is very inflamed, when we have a lot of inflammation, and remember, inflammation happens when we get sick. From cutting our hand to have an infection, our body needs to have inflammation to work. Mm-hmm. When that inflammation goes up, that channel gets down-regulated. It doesn't work as well. So we are unable to get vitamin C into the cell so that it could be utilized.
And the other studies, and you mentioned it in passing too, the hydroxychloroquine and that being promising, and different, doctors looking at that as being a component to treatment for people with coronavirus, COVID-19. What's the sign? What is your opinion on that? And how is that connected to these different vitamin C protocols out there?
So the reason they're choosing that, again, remember our focus, we're moving away from the focus of treating the virus per se to treating the inflammatory process. And I think that's the key. So it turns out hydroxyquinoline, which is a common medication used for malaria, also used in lupus and some other rheumatological disease.
Plaquenil is kind of the brand name, right?
Thank you. Actually downregulates the immune site, what we call immune markers. And the two main markers are these things called cytokines, which are inflammatory markers. And the two ones we think about is this thing called interleukin-6 and tumor necrosis factor alpha. So it turns out Zithromax and hydroxyquinoline both downregulate that. I mean, what's interesting to people, we almost think of antibiotics only given in bacterial infection. What people don't realize is that certain antibiotics, Zithromax, and actually we're learning probably doxycycline may also work, or also serve a purpose of downregulating inflammation.
So basically these immunosuppressants or like hydroxychloroquine are calming the inflammatory response or suppressing the inflammatory response. But like what you said, it's the immune response against the virus that is ultimately killing people. Is that correct to say?
Right. And actually they have a second role. I didn't bring it. This one you'll like because this is a functional medicine role. They actually increase zinc concentrations. So it turns out zinc, and, we always talk about zinc when people get a cold or, to protect that. Zinc turns out to block virus replication. So it's interesting. So hydroxyquinoline and the Zithromax all also increase zinc concentration in the body.
Fascinating. I didn't know that. Interesting. So, okay, you have all these protocols out there that are promising. How about the people out there, those of us that want to prevent this and do whatever we can? We don't have COVID-19, but we want to do the best we can to support our immune system because we're seeing these people with immunosuppressed problems or they have other underlying health problems. They are more prone to these infections. You mentioned vitamin D being protective there. What else would you suggest for us to do to support a healthy immune system?
I think zinc is also really important as well. Okay. So zinc, again, because zinc does have that impact on virus replication. It also seems on COVID-19, zinc seems to also help with a lot of the digestive issues that go along with it. One of the things that we're seeing with COVID-19 is people are getting a lot of gastrointestinal symptoms as well. Mm-hmm. And here's one you may not have thought of, quercetin.
Okay.
Also works.
What is that?
So quercetin is a citrus bioflavonoid. It actually comes from the skin of a fruit. It actually also acts as a natural antiviral. It's actually been really well studied in patients with HIV or hepatitis in decreasing the amount of virus that is present. So that also helps, again, prevent what we call viral replication or increasing the viral load.
Got it. And then what doses would you recommend for the zinc and the quercetin and the vitamin D? Just general.
So what the studies they've looked at, and this is from China. So they looked at vitamin C from 500 to 1,000 twice a day.
As preventative.
Right. Zinc from 75 to 100 milligrams once a day, and quercetin from 500 to 1,000 milligrams once a day. I mean, vitamin D, I didn't see a specific recommendation, but again, it depends on, how much your body needs. A lot of people are using probably 1,000 to 2,000. But again, it's a fat-soluble vitamin, so you got to be careful taking too much. But that one may vary greatly depending on the person.
You know what I love about this discussion, Will, is you and I have been talking about this for years on this show. Keith has been out there championing, kind of doing more natural things. This underscores why nutrient density in your diet is so freaking important. Like, all of these things are found naturally in foods that we eat on a low-carb ketogenic diet. And now we're seeing a real life or death, literally life or death situation out there that's underscoring why what we've been talking about for so long is so important.
Yeah, so true. I mean, maybe we should talk about that for people that are maybe newer to the show. Keith, what would you recommend? Some of those nutrients that we just talked about, what are foods people should focus on that have these nutrients in them? If they don't, maybe they can't afford supplements right now, or a lot of supplements are back ordered or out of stock because of the amount of people buying them. So what are some foods for people to focus on?
First of all, I have to tell Jimmy, that's my favorite 2 words in the English language.
Nutrient dense.
Nutrient density. Exactly. I've actually gone away.
I knew that already.
I've gone away from, for years it's using the word low carbohydrate, but in reality, the reason, can I explain why I think that's so important?
Sure.
And then get into the other part is I think when I first started in the low carbohydrate arena, we really only talked about blood sugar. I mean, that was the big thing. Control your blood sugar, control your blood sugar. I think today it's changed. I think there's another important part of it, which has become digestive issues. 15 years ago, I rarely saw anyone with significant digestive issues. Now, if you look today, I think the average person does have issues with digestion, whether they have gas and bloating, issues with heartburn, diarrhea, constipation. And the key to that is not only is it eating the right foods, it's also how you prepare the foods and how they're served. So it really has changed. And again, we want to eat things that are both nutrient dense, but also effectively digested.
You just made Will Cole so happy, because that's been like his theme song for how long, Will?
Yeah.
15 years.
It's the 6th.
Well, you can send me a check afterwards.
Yeah, gut health is my love language. So,
Will, I kind of know that. I saw your lecture, by the way.
You're
remember?
sucking up to everybody. Somebody suck up to me now. I'm just kidding.
So foods.
So getting back to the question is again, it's not only it's the foods that contain but it's foods that also help stabilize your blood sugar. Mm-hmm. I know I saw you posting a lot in the last couple of days about people who are diabetic or have heart disease are much more likely to get sick from this disease. So remember, when our blood sugar is off, we're really more susceptible. There's so many studies that have been done on infectious diseases and also autoimmune diseases that show that people that have a more volatile blood sugar are much more susceptible to get sick and have complications. Mm-hmm. So my first recommendation, even before the nutrients, is actually focus on eating foods that will stabilize your blood sugar.
Right.
And my favorite, I have a favorite one, which is 2 favorite ones, eggs and avocado.
Yeah.
Love it. That's the cover of Ketotarian right there. Is an egg inside it.
I told you, I saw your lecture.
Avocado, everybody.
Avocado.
Okay.
I actually saw Will Cole speak in Florida, so he remembers.
Yes,
we both spoke at a conference
I saw
together.
you too. Yes, thank you.
So, but again, and what's interesting, I have a take on the eggs. I don't know if you have this take. I actually don't think you should serve them hard boiled.
Yeah, I agree with that.
Because I think what happens is one of the issues they have when the fat and protein is separated, it's much harder for your digestive tract to integrate it and use it as energy.
Because of the concentration of the egg white.
Correct. And also
it has avidin in it and some other things you don't want anyway.
But also on the fat side. So what we're learning today, one of the issues from digestion is, and again, people who do adopt a low carb lifestyle obviously are consuming more fat. One of the issues they have is sometimes breaking down those fats. And so the way we prepare things makes it much easier. And even if you think about meats and stuff, people have a much easier time eating meats that are in a soup or stew form than they do something that's grilled. So again, that makes a difference as well. And my favorite one is vegetables, where I prefer things that are roasted or cooked than raw from a digestive standpoint.
Oh, certainly. Yeah. Okay. So basically what you're saying is eat foods that balance your blood sugar, because that's so much needed for our immune system. And then as far as nutrient density, if you're talking about these specific vitamins from foods, what foods should people focus on?
You probably know this better than I do. So, so you'll correct me if I'm wrong. So
no,
when we look
fine.
at zinc, what's the biggest in zinc? You probably know better than I do.
Yeah, I would say nuts and seeds are a great source, and organ meats are a great source of it too. But going back to your earlier point with the vegetables and having them cooked, I would say soaked nuts and seeds makes them more digestible, just like cooking the vegetables will make them more digestible. And I think organ meats are a wonderful nutrient dense food for people to focus on during any time, but specifically people that are wanting to go to nutrient density to support a healthy immune system. Definitely a smart time to do that.
And also vitamin C. People forget that organ meats are actually also a very good source of vitamin C as well.
Exactly, yeah.
So one of the things interesting is also when I go to the nuts and seeds, there's actually certain ones I would avoid. And those are your cashews, peanuts, and pistachios, which actually technically are not nuts.
Legumes, yeah.
Legumes and fruit.
Right.
And again, they also tend to have issues with digestion and much harder to digest. So they're much challenging. When it comes to quercetin comes from the skin of the fruit. So I guess we can eat the skin of citrus fruit where the fiber part is.
So we can have an orange peel?
Why not? They make them, which you can have around with low carb chocolate. That's often I like the way he's
Sounds
thinking.
Good.
But it's all the essential oils in there as well. So is that maybe some of the benefit you're getting is the essential oil?
Absolutely. Because again, one of the things that people don't realize, and this is one where I kind of disagree with a lot of people on, when you look at things like fiber, right? And again, the skin of a fruit is fiber. Fiber really likes fat better than it likes water. So like, I'll give you a great example. When people can eat a lot of avocado without feeling gassy or bloated, right? But if you have a grain-based fiber, you have too much of that. The first thing you're going to do, you're going to feel stomach discomfort from the bloating. Right. So actually, fibrous sources mixed with the right fats is probably one of the healthiest ways you can control your blood sugar, actually, from an eating perspective.
Dr. Berkowitz, thank you so much for being on the show and giving us this really important information right now.
Oh, thank you so much for having me. And Jimmy, I do know something outside of reactive hypoglycemia.
Uh-oh, yes, you do.
That's been proven.
I was telling Will, you had some interesting insights about childhood trauma and the effect on your body as well physically. Maybe we'll bring you back sometime to talk about that either on this show or my other show. I would love to do that.
Well, thank you so much for having me. And I want to thank you both. And what's really important, and the audience should know this, how much effort you are in actually trying to stem this disease process and how difficult the time people are having. And one of the biggest reasons they're having a difficulty is all the confusing information they're getting on a daily basis.
Yes.
So I have to applaud both of you for really giving people a really concise, well thought out, information program about it. So important. Because I think, and I'm seeing in my own patients, the amount of anxiety that's coming about from so much misinformation being given.
Oh, that's the thing that Will and I have been talking about the most is the mental health fallout from all this. Never mind the economic fallout and all the other obvious things. People are going to be on like PTSD so bad after this is all over.
Agreed. And thank you for doing that. I learned from it as well, but I think it's so critical that people really understand that part. Because you cannot be healthy without that aspect.
Right. Yeah. Thank you, Keith.
Thanks, Keith.
Thank you.
You've been listening to Real Talk with Jimmy Moore and Dr. Will Cole. Listen to the show wherever podcasts are heard. Go to llvlc.com to learn more about what we talked about on today's show. Thanks for joining us for Real Talk. Come back next Thursday for more Real Talk from real people.
Disc of light.